Good morning, everyone. We're just going to let folks get into the Zoom room and we will start in just a moment. Well, good morning again, and welcome to We Serve Too, Increasing Resiliency in Military Connected Youth, with our presenter, Sarah Flowers. This presentation was prepared for the Great Lakes PTTC under cooperative agreement from the Substance Abuse and Mental Health Services Administration, SAMHSA. The opinions expressed in this webinar are the views of the speaker and do not reflect the official position of the Department of Health and Human Services and SAMHSA. The PTTC believes that words matter and uses affirming language in all activities. If you are having any technical issues, please individually message me, Jen Winslow, or Chris Gabrielson in the chat section at the bottom of your screen, and we will be happy to assist you. If captions or live transcript would be helpful, please use your Zoom toolbar to enable them by selecting live transcript. AI note taker options, please do not activate the AI note taker application. We do not allow this for several reasons and will ask you to disengage. If you do not, we will remove you from the Zoom room. If you have any questions for the speaker, please put those in the Q&A section on your Zoom toolbar rather than the chat so we can better keep those organized and have them answered. Certificates of attendance will be sent out. Oh, I'm sorry. You will be directed to a short survey link at the completion of this webinar, and we would appreciate if you could fill it out. It takes about 3 minutes. Certificates of attendance will be sent out via email to all who attend this webinar in full. It can take up to 2 weeks to receive certificates. If you would like to know more about what we are doing or information about upcoming events, please see our social media pages and our website. And now I'm pleased to turn this over to our presenter, Sarah Flowers.
Thank you, Jen, and thank you to the Great Lakes PTTC for inviting me here today. I am really excited to join you all. Good morning. Thank you so much. April is month of the military child, and I am so excited to be with you all today and celebrate the strength and resiliency of our military connected youth across the Great Lakes region and across the world. My name is Sarah Flowers. I am the Military Family Resiliency Specialist for Kentucky, and I work with local and statewide organizations and coalitions, helping increase awareness of the military presence within Kentucky and provide technical assistance and consultation on engaging military-connected groups and organizations and individuals, and implementing best practices for preventing substance use and suicide and increase overall well-being and resiliency within military connected youth. But besides my professional resume, I am a proud Navy brat. I grew up outside of the largest naval base in Norfolk, Virginia, which I'm still proud to call home. I am also a proud Gold Star sibling, and my father served in the military for 20 years. Both of my brothers served in the Virginia National Guard and also on active duty within the Army as well. My unique experiences really helps me to engage and work with our military connected youth. I have experienced firsthand deployments, relocations, living in foreign country, transitioning back to the United States. I have seen the impacts of war and combat through the lives of my brothers, the difficulties and challenges navigating transitions, the struggles with substance use disorder, as well as mental health issues. And knowing and growing up with all of that, I didn't really understand my own personal strength and resiliency until I was introduced to prevention back in 2017 when I attended a suicide prevention training, QPR gatekeeper training. And it was at that point that I realized there are specific risk factors and things that have been identified that increase the risk of suicide and substance use within our military connected population. And from that moment, I was transformed personally and professionally and have been working to increase this awareness within the prevention field, not only within the state of Kentucky, but across the country with national partners such as the PTCC. So I'm really grateful that you all are interested in learning more about how you can celebrate and increase the resiliency of our military connected youth. As you can see here, I have the lovely picture of a dandelion. If you are not aware, the dandelion is the flower of the military child, because dandelions can be found everywhere and they flourish and bloom across the country. And so they grow in between rocks, in the cracks on the sidewalk, in your yard, but they can really grow and thrive in really challenging situations. And so today, that is what we're going to do, is take a look at how you can implement some simple strategies to really increase that resiliency and help those dandelions bloom. So I will go ahead and share my screen here. So military connected youth experience unique challenges, impact their educational and social emotional learning, putting them at greater risk for substance use and behavioral health challenges. By working with the schools and the community, we can cultivate a competent and supportive environment that really helps mitigate those challenges. And we're going to look at how you can enhance existing infrastructure to deliver substance misuse prevention programs to military connected youth. So some of our learning objectives for this training is to really understand those risk factors that make military youth more vulnerable to substance use and behavioral health problems when compared to non-military connected youth. We will learn how to describe how to increase the capacity and readiness to serve military connected youth in your communities and in your state. And then we will identify evidence-based practices that support and build resiliency within military connected youth. So before we go on with the training, I just want to take a moment to pause and ask you all, what's one word or phrase that comes to mind when you hear the word military connected youth? And if you could just go ahead and drop that in the chat, whether it's because you're military connected yourself or things that you understand about military connected youth. Got diverse, the network, constant change, resilient, struggling, challenge. They move around a lot, deployments. They're resilient, foundation, misunderstood. I like that. That is very good. Moving, resilient, ever evolving and resilient. I like that. Transient. Yes, military connected youth definitely have to be able to adapt and learn how to cope through many different things. Stressed. Excellent. Structured. I missed that one. That was a good one as well. Confused. So yeah, a lot of these terms are really talk about some of the challenges that military youth face. Flexible, and we really want to get an understanding of those challenges that may make them more stressed and more confused, but we want to be able to show them and identify how flexible they are, how resilient they are, that even though they're very transient, how strong this can make them and the end, and how moving to different places and gives them a concept that other youth do not have. Um, and so they are very well rounded, yes. So you can continue to put things in the chat, and I will attempt to monitor them, but thank you all for putting those phrases in there. So when we talk about military connected youth, we have to identify who are we actually talking about. So our military connected youth can be a complicated term because most people think that it's just those immediate children, whether that's foster, step, or adopted children. However, the preferred term now is military connected because we want to be able to include grandchildren. You know, there's a lot of grandparents now that are raising grandchildren. We want to include brothers, sisters, nieces, and nephews, and other close relatives because, you know, even myself, I was in high school when my brother was first joined the army, and it impacted my life. And he was living in my home, and the things that I saw impacted my life. And even as an adult, with my own children, their nieces and nephews were impacted by their experience with the military. We also want to make sure that we're including not only those active duty military, and active duty is the term that we use for service members who put on the uniform every single day. It's a Monday through Friday job. And so that is the term that we use for those active duty military. Our National Guard are actually employed by your state, and can be called up and activated anytime your governor issues orders for the National Guard to be deployed. Our National Guard can be deployed oftentimes more than the active duty service members. They can be deployed for things that are here at home, such as natural disasters. In Kentucky, they were deployed during a flood, during tornadoes. They were also deployed during COVID to assist with the vaccinations and traffic. And so our National Guard is oftentimes deployed more frequently than active duty. We've got our reserve component, which is our kind of our part-time military. They work for the federal government. And then we've got our veteran families, or those families who have had previous military experience, whether that is from before the child was born, or the child may have been, you know, they may have been very young when the service member was active duty, but now they have since separated, retired, or finished their careers with the military. And with each of these unique types of military families, you've got certain risk and protective factors within each of those different service levels. You know, our active duty families have access to programs on their installations and their military bases. They've got access to healthcare. They've got the community and support of being around people that understand them and are familiar with them. Our National Guard families are geographically stable. They don't necessarily transition or move around a lot. However, they may be in a very rural county that doesn't understand what military life is like. They may be very far from their National Guard post, which makes them feel that maybe their local community doesn't understand them. And that's very similar with our reserve families as well. They don't always have access to the same healthcare coverages and programs that our active duty families have. Our veteran families, once they have left the military, they oftentimes miss that camaraderie or that community that they once had within the active duty service. Some have access to healthcare and some don't. It just depends on how long they served and where they served. It can be very complicated to be de determined because of the federal guidelines as to what defines a veteran. And so there can be unique challenges within each of these service levels of our military, and we want to be mindful that we are inclusive of all of them. And so when we're looking at military connected youth, they live in your community. You may not see them, you may not see them because they're not wearing service uniforms. We can oftentimes identify our veterans by certain hats that they may wear if they're a Vietnam veteran or an Army veteran or a female veteran might wear a hat. But oftentimes our military connected youth are not always identified. And this data here is brought to us by the Military Family Research Institute at Purdue University. And military youth are in every single community. We can look here and see the number of active duty military youth. We look at our reserve youth. And the reserve children include both our Federal Reserves and our National Guard children. And we've got the total number of youth 0 to 18. And then we've also got our percentage of veteran households with children. And in Kentucky, every 1 of 10 adults identifies as a veteran. And so, those numbers are clearly evident that military youth are in your community. There are military installations on every single state across the nation. Illinois has 8 and is home to the largest, the Navy's boot camp is in the Great Lakes region. Indiana has 4 military installations. Michigan has 5. Minnesota has 3, Ohio has 8, and Wisconsin has 4. And those are just the military installations, according to Military One Source, that are approved by the Department of Defense or DoD. And so those are most likely active duty stations or the main National Guard commands. But there are National Guard posts throughout many, many, many communities throughout your states. And so this just kind of gives us a picture of the number of military connected youth that are within your states. So military culture really values strength and resiliency. However, there are some families that are at greater risk. And as mentioned, the National Guard and Reserve families, because they don't have those same access to benefits and programs and support, not being identified within their communities, not being understood by their communities, they're often very far away from their units. And so this can kind of cause a greater risk for National Guard families. We've also got families who experience multiple deployments. So some families, especially since 9/11, have experienced multiple deployments throughout their military career. We've got single parent families or families where both parents are serving in the military. You've got family members who have mental health challenges. Our enlisted or the lower ranking families can sometimes have greater risk because they don't have the same financial stability as the more experienced or the officers within the military. We also have to understand the barriers to help seeking in the military culture. That's embedded within not only the service member, but the families as well, that we are strong and we don't need to seek help and we, keep moving forward. You've got families who have had service members with wounds from service, whether that's the physical wounds from combat or they come home and they have mental health and emotional wounds from their service. And then you've got families who are survivors. So, Gold Star families are family members who have lost a loved one while serving in the military, and that could be combat related or it could be by suicide. And so they have some unique risk factors. You also have to take into consideration some individual risk factors such as gender and race and ethnicity, and all of those things impact not only the service member, but also the family members as well. And so now we'll go into a few of the um, most apparent risk factors that are experienced by military families. And the first one we'll talk about are deployments. And for myself personally, when I was in middle school, my dad deployed and he missed a chorus recital that I had for school. He missed my softball games that I was attending. It was hard on my mom raising kids. This was our first deployment as a family. And so it really was a stressful time for us. And it really depends on whether the at home parent is how they're coping with stress. Do they have the support system that they need? There are going to be adjustments at home. Children have to contend with their own feelings of loss and concern about the deployed parent or the deployed loved one. Are they in harm's way? Are they safe? During deployments, youth may lack a lot of stability. They feel like they have a loss of control. They may experience difficulty sleeping. They might have extreme fear for the parent's physical safety, but also for their own. And research suggests that although these symptoms tend to subside or lessen after the initial deployment starts, longer deployments can actually cause worse reactions, as well as depending on the number of deployments and where the family member is deployed to. I remember when my younger brother was deployed to Iraq and checking my phone every day to see if he had messaged me, if he was okay. Those things really impact how individuals manage their stress, and it can be a really challenging time for some youth if the proper support systems are not in place. Post deployment, so once the service member comes home, it can bring some intense relief and joy, but there's also this period of readjustment as families transition to a new normal. So while the service member is deployed, children may have to step up into a caregiving role for younger siblings or taking on more responsibilities at home. And so youth may struggle with that change when the service member comes home. Youth may struggle with trying to reconnect with the parent. They may have fears that their parent won't remember them when they come back or won't love them the same way. There's also increased risk of maltreatment during deployments, and shows that especially within the Army, they found that the rate of child maltreatment was 42% higher during deployment periods than during times when the service member was not deployed. So again, they must all adjust to their roles and responsibilities at home. And also, the challenges of having a service member that returns with physical or mental challenges. And so deployments can be some of the most challenging impacts on a child. And again, not just the biological children, but children in general. Myself, when I graduated from high school, my brother was overseas in Germany, and I did not attend my high school graduation because he was not going to be able to be home for me. And so those are just lasting memories that we have because of these experiences. Department of Defense averages that military youth moved 6 to 9 times during their K through 12 education. That's 3 times more often than their civilian peers. It can be disruptive to friendships. They have to learn to adapt to multiple schools, multiple communities, all while grieving over what was lost with each move and during long periods of times without their belongings. The military might pack you, but you may get to your new duty station before your furniture arrives. And so I remember when we first relocated from England to Virginia Beach, it was me and my mom and my 2 brothers living in an efficiency hotel room for months before we were able to find a home. And that was really challenging in the summer, living in a small efficiency hotel for months. We didn't have our personal belongings, our clothes, our toys. We only had what we were able to pack in a small container to bring with us. There's a lot of added stress that can occur and really increase tension with families. You've got issues with students who are transferring to their new schools that some of their credits might not transfer from the previous school that they attended. If you include students who have individualized education plans or 504 plans, that can be challenging for our exceptional family members. It can impact their ability to play sports at the school. You've got finding new doctors, new primary care. You always feel like you're the new kid, and it can be hard for some kids to make new friends and make those connections, especially if they know that they're going to be moving again in a few years. What's the point of making friends and finding best friends if I know I'm not going to have them in a few years from now? And so those active duty families that moving around a lot can be very, very challenging for our military connected youth. We also look at the high rates of spouse unemployment. Nearly 1 out of 4 military spouses are unemployed. And this can be due to a lot of different factors. While in the military, you have unpredictable and lengthy work schedules. And so oftentimes daycare do not stay open past your 6 p.m. Childcare can be very expensive, and so it may be more beneficial for a family member to stay at home. My mom was a stay-at-home mom. They've got the length of time being out of the workforce, and so it can be hard getting back into the workforce. If the service member is relocating or changing duty stations or deployed, it can be really challenging for that at-home parent to be able to find steady employment. They may have caregiving responsibilities. So we have, especially with our veteran population, we've got caregiving responsibilities. We've got challenges with changing licenses and certifications once you go into a new state. You may be, certified as a prevention specialist in Kentucky and you move to Virginia, and now there's a challenge with getting that certification switched over. It can be very difficult for our military spouses to find steady employment. And those that are in uniform, they work and they train hard to stay ready. And many do not serve without support. And our military families help keep our families together and allowing service members to do their job without the burden of the worry. And so we really want to take into consideration that that's a lot of times it's a one income household, and we live in a world that is not, the finances and economic stability is so important for the well-being of individuals and family members, and it's really important for us to take those things into consideration. Along with the financial burden of possibly not having two parents or two people working in the household, military youth experience food insecurity. 46% of military teens report some level of food insecurity over the past month. And military teens who reported having food insecurity, their parents usually have a lower pay grade, um, usually an enlisted rank. They can be particularly vulnerable to experiencing food insecurity due to the unique factors of military life. They may be able to have an allowance for food and clothing, but it doesn't always cover the total cost of what it needs to have food, regular, healthy food within their homes. You've got some families that may have be in rural communities and not have access to certain resources. For teens who reported experiencing more moves, more relocations, generally reported experiencing greater food security. And so, with moving often and not finding steady employment, the military might cover some of the cost, but it doesn't always cover the increasing costs of rent and what it would really take and the damages and things that had to be replaced because you're moving your whole house from another country to the United States. And so it doesn't always cover the cost of moving, leaving less money available for the necessities such as food. And military teens who reported greater food insecurity were generally more likely to also report thoughts of harming themselves or others. Since 2003, the rates of child maltreatment and family violence in military families have outpaced the rates reported for non-military families. So the rate of neglect or failure to meet the children's basic needs has increased, particularly where one parent is deployed and the other parent is at home with the household. The abuse or neglect is more often done by the active duty parent. So that's in 54% of cases compared to 40% of the at-home parent. It's oftentimes more likely the father in 57% of cases. And again, those younger enlisted members are most frequently the perpetrators of child maltreatment. And it should also be taken into consideration that the rates of domestic violence and alcohol abuse, both which are linked to child maltreatment, are higher in military populations. And about 30 to 60% of military families who experience domestic violence also report experiencing child maltreatment. In the Army, child maltreatment occurs twice as often in military families with a history of domestic violence. And oftentimes, child maltreatment or neglect can simply mean that that at-home parent just can't cope with the challenges, especially if they are deployed to a combat zone and the at-home parent is continuously worried or having difficulty with childcare or navigating children's behaviors and emotions. And so all of these things we have to consider when trying to understand military families. Growing up in a civilian-dominated community can be extremely hard to talk about because not many people could relate. Schools and communities lack understanding. Most of my friends in my adult life are military connected. They've shared similar experiences as me, and we have the understanding that we like to move around a lot. We like to try new things, um, and we have that same connection. But when schools and communities don't understand those unique challenges, it can be very difficult for the student and the families to be able to reach out for help. Parents and school staff report that teachers and counselors are not adequately trained for working with children with a deployed parent. I had she was an Air Force veteran. Her husband was currently in the Air Force and deployed, and she was having a challenge with her son in school and went to the school counselor. And the school counselor gave them resources and support on the topic of divorce, as if divorce was somehow compared to similar feelings and experiences of having a family member or a parent deployed. And so that school really did not understand what that family was going through. And adolescents report that counselors don't understand what the youth are going through. And schools report that they are often not even aware of the deployment until the problem begins to arise, until they see things within the families. And because of military culture, there are barriers to help seeking, and that may then be seen in the youth as well. And so if a child or an adult does not feel like you're going to understand their situation, they're less likely to come to you for help and share with you the challenges that they are experiencing. Some parents don't want to inform the school because they don't want their child to be treated differently. Some students don't want to tell the school because they don't want to be seen as different or having a problem or being teased because they're having a problem. Students are going to be reluctant to talk about deployments with non-military connected students. And it can just really impact the ability for the youth to feel like they're in a safe environment where they're reaching out for help. So, with all of these risk factors in mind, we see in the data that military connected youth are experiencing and reporting higher rates of suicide and substance misuse. And that is seen in thoughts of suicide, developing a suicide plan, attempting, and 24% of military connected youth report seriously considering suicide compared to 18% of non-military connected youth. Almost 12% of military connected youth had attempted suicide during the last 12 months, with only 7% of non-military connected youth. And regardless of the number of military deployments, youth with deployed family members report higher rates of substance use. Youth with a sibling in the military use substances at higher rates. And substance use, excluding lifetime smoking, was found to be positively correlated with the number of family member deployments. So the greater the number of deployments, the increase of substance use. And recent drug use was highest among youth with a current deployed parent. And so we can see that the food insecurity and lower financial and economic stability, having misunderstanding communities. They're reporting being bullied more, kicked and slapped compared to non-military connected youth. And so that on top of having a culture that does not believe in seeking help, it really leaves military youth to feel alone and misunderstood and not having anyone that they can really talk with. And so that is why it is imperative for us as preventionists to really start to prioritize this population within our work, within our needs assessments, within our coalitions, and with it, whether that's at the local level or at the state level, it is imperative for us to begin to identify these military connected youth. And this is from national data. And in Kentucky, we added a military identifying question to our youth surveys and in 2014, and we immediately saw the same data that's being reported on a national level with serious psychological distress at 3.4% higher rates than non-military connected youth, as well as alcohol, tobacco, and other drug use with our military connected youth. And in 2014, we really began to prioritize this population within our work. Take a moment to reflect on some of the things that you saw, things that maybe have resonated with you, things that you may have seen that really surprised you or that you didn't understand or didn't know about before. And so if you could just take a moment and drop some of those things in the chat. I appreciate Irene, I feel this. And Jason, yes, thank you for putting the MIC3. We're actually going to bring that up here at the end. Not acknowledged often is the effect of non-military youth. Yes, they experience on the opposite constant moves of their. That's true. Can be a great impact on those that don't understand military culture and who aren't military connected, and those friends that are left behind. Food insecurity, yeah, that's something that's really started to come out nationally.
Sarah, I thought I'd jump in, and I just wanted to point out that with Kelly's comment of, she says, I'm so sorry to admit that being in this field for 30 years, it never occurred to me to be aware of this population. And I just want to say I'm right there with her. And that's what, we decided to bring you in after I saw your presentation at the NPM Research Conference, because it was completely eye-opening to me too, that, thinking I don't necessarily work, but we don't necessarily work specifically with this population, and I felt like it was more of an isolated kind of group. So just wanted to point out and validate, Kelly, that you're not alone, and I'm guessing there are others here who are feeling the same way. So just wanted to highlight that. And Sarah, thank you for bringing this to us. I see we've got lots more in the chat too, so I'll hand it back over to you to point out some of those things.
Well, I appreciate that, Chris. I really, this is, because of my personal experience, this is my heart and soul and what I'm passionate about. And I'm always enjoy bringing this information to others. And I appreciate everyone's openness. Whether, I see some military families here with me, my fellow military brats. And so I appreciate you all being so engaged and open. At helping changing norms, going to school in military town made a difference, San Diego. So you may not have been in the military, but you understood growing up in San Diego, different challenges and things. schools not being aware surprised me. I'm sure this varies by school and concentration of military connected students. I I grew up in Virginia Beach, Virginia, and it's the world's largest Navy base in Norfolk, and there's a Naval Air Station in Virginia Beach, and there's actually 3 military installations in Virginia Beach. And my son goes to the same high school that I went to, and there's just not that when you walk in, you just don't feel that presence of we're here to support you if you're a military family. And so I'm sure they may have trainings and things, but it's really about that welcoming environment. As soon as you walk in, that you understand that this is going to be a place that supports you, supports your child, and really has the tools and resources to help them thrive. And so thank you all for your input in the chat. There's so much and I won't be able to read it all, but hopefully it'll be saved and shared. But thank you all for contributing to this conversation. So now that we've looked at some of those challenges that military connected youth face, we're going to talk about the best practices for supporting our military connected youth. Strength, perseverance, sacrifice, those are all words that we associate with our troops. But these are some of the same traits that we find in military connected youth. They send care packages to their deployed family members. They take on new tasks when the situation changes. They understand, okay, it's time to move again. Here's what we got to do. Let me pack up my room. I know how to do it perfectly. They are very resilient and they understand those challenges. And so what we want to do is really help grow those strengths. Yes, look at how you've moved to so many different schools and made so many different friends, and look at your life's experiences. How many people have been able to travel Europe and live in a foreign country? And so it's really about, understanding and honoring those challenges, but then also understanding that there is that strength within their core that is embedded within them. And how do we get that to grow? How do we make that move within their lives? And so we really want to celebrate their achievements and recognize their efforts, which, is why we have a month of the military child. And so the first thing that we have to do is identify our military connected families. There is the Every Student Succeeds Act, which there's a federal impact aid that schools identify those military connected students whose family members are active duty. So because the school can get money and support from the federal government because they have those active duty students. And so they're already asking that question, but we have to go beyond asking just those active duty students. And we really have to ask, are you National Guard, Reserve, or veteran? And we have to be able to start educating people and letting them know that the military connected children are within our community. And that's, both our healthcare providers, our educators, our neighbors, our faith-based organizations. Some faith-based organizations may honor the veterans in their organization during Veterans Appreciation Month. And so all of those things are ways that we can identify those families within the community. And the benefits are improved connections. So once you identify those military connected individuals, you can begin to connect them with resources and access to care. You can encourage family members and community members to provide extra care and assistance to children during times of transition. There's an increased need for understanding of military culture and military child experiences to strengthen those social supports and create that same sense of community belonging. And educating the schools and the communities on the challenges faced by military families, and partnering with those schools to provide and foster those diverse, inclusive, and supportive environments for military connected youth and families. So, understanding schools and communities. A family's perception of community support and feelings of community connection are directly related to the adolescent's or the young person's well-being. And parents' perceptions of their community's understanding of their military lifestyle are related to feelings of belonging in that community. I was very fortunate when I transitioned back to the US in third grade. I had a teacher, and her name is Miss Whitwell, and I will never forget her. But I moved from England with my family, and I had an English accent and was in a new school with new students. And no one, I was teased because of my accent, but my teacher, although she wasn't military connected, she was English. And so she really brought me in under her arms and really loved me and really just helped me to feel that sense of belonging within that class. Schools can provide consistent and high expectations for students, which can foster resilience. Um, they can listen, having someone outside of the home who knows what's going on gives them a safe place to talk about what's going on in their home. And because oftentimes, if a young person is struggling with things that are going on in the home, they're not necessarily going to go to the parent that's at home because they don't want to rock the boat. They don't want to stress mom or dad out more because they already see the stress that's going on because of the deployments. Reach out to those military connected youth, those military connected youth that might have a difficult time being the new kid at lunch table, not having anyone to sit with. It can be hard for these military youth to find their place in the community. And so just by saying hello or offering to include them in something can be so appreciated. I've just briefly saw things in the chat, about learning about your available resources, the Military Interstate Children's Compact Commission, which is mentioned in the chat. You've got the school liaison program. Somebody put in their military family life counselors. You've got the exceptional family member program. You've got employee resource groups at some organizations. And so learn about those resources that are available to your military families so that you can be able to offer and provide that support. And instill a resilient attitude. So, like I said, we really want to highlight the benefits of living on all of these different military installations and how they've had the ability to live in different countries and experience different cultures and experience different states. They show them that there are resources that are available. And, by living on a military base or living near a military base, you have people that understand your similar challenges, and that can offer safety and potential for more freedom by giving them that information that you're not alone. Focus your attention on the positive aspects, aspects of military life and relocation and being able to, join a new sports team or develop new interests. Okay, so you weren't allowed to join the soccer team semester, but let's try something else. Let's see what other gifts and talents that you have. Educate military families on their rights and protections that are legislated by local and national government, like the Military Interstate Children's Compact Commission, which protects military families from during transition. It helps them get credits transferred over. If you were stationed in Virginia and had to take Virginia U.S. history as a graduation requirement, but now you move to Ohio, that same credit will transfer over. Let them know that there are protections that they have. And then again, that exceptional family member, if you've got students who have 504 plans or individualized education plans, there are programs that support those family members. So we've got encourage them, youth sports, clubs, and activities. Encourage the student involvement in those activities. They can find a sense of connection, a sense of self-pride, self-worth. It can also create a space for parents to meet other parents, while we're sitting on the bench watching, our young people playing soccer or softball. Now the parents are able to connect. It gives them an opportunity to make new friends, whether that's in the school or within the community. The YMCA offers military family discounts and free programming while service members are deployed. And so it really just creates those social connections that are important for all family members. It's particularly the adolescents. It helps them cope with relocations and deployments. And students really want, and young people really want, those informal spaces to be able to interact and connect with other youth. And sometimes that can be challenging within the school. And so by having these other clubs and activities can be really beneficial. These peer groups and transition teams, they create positive social relationships and are really help with grades and lower depression and lower anxiety. If you have a program within your school for military connected youth where they can connect and meet together on a regular basis, and the Military Child Education Coalition has a student to student program. There are Anchored for Life programs that are both evidence-based programs that create that peer connection for these military groups that understand and take you on the school tour when you're the new kid and eat with you on lunch for your first few weeks at school while you're trying to find that peer group that you're going to fit in with. And so these peer groups can be really vital to have this safe landing space for youth that as they're transitioning to a new school, or if they're going and transitioning through a deployment or out of the military, these groups and teams can be very, very beneficial. And now we talk about the Purple Star Award, and I will shout out to Jason Scragg because I have worked with him through our National Purple Star initiatives. And I have to give a shout out to Ohio for starting this program through their Department of Education. And the founder, Pete Lupiba, who was an Air Force veteran, started having conversations with veterans and educators and other family members about how schools can better serve those military students and families. And so the Purple Star Award really helps increase protective factors and reduce those risk factors for substance misuse and behavioral health issues within military-connected youth. It provides that caring school environment, increases youth engagement, encourages positive peer influence, personal responsibility, and involvement from parents and other adults within the school and the community. And the Purple Star Award designation lets military parents know that whether they're on active duty, National Guard, reserves, or a veteran, that school is dedicated to helping their child gain the educational skills necessary to be life ready. And the program started in 2016, as I said, in Ohio. Kentucky joined in 2021. We launched and awarded our first two schools in 2021. And at that time, we were the 11th state to implement this program. And now I am proud to say, just 3 years after we started, there are now 44 states across the US that implement this program. It is supported by the Department of Defense, and it is also supported by the Military Child Education Coalition, which is a national nonprofit for military connected youth. And as you can see from your map here, those states that are in purple have Purple Star designation programs. Minnesota proposed pending legislation this past session, so it's possible that that was passed. And Wisconsin is still working on their program and their legislation. And so how does the Purple Star Award really help create that positive environment and supportive environment for students? So the Purple Star Award is an actual award that is given to an individual school once they meet these 5 requirements. And these are the requirements that most states have adapted or implement. Each state can be a little bit different because the needs are different in every state, but these are the core components for the Purple Star Award. You are to identify someone within the school that acts as the primary point of contact for those military connected students and families. The school is required to attend a training that informs those liaisons and other school staffs about the special considerations needed by military connected students and families. They create a dedicated page on their school's website that features resources, local resources for those students and families. They create a led transition program to provide peer support for those military connected students, and they host military recognition events or activities or programs within their schools. Like I said, these are the 5 main components, but each state will be a little bit different. And once the school completes these requirements, they submit their applications. They're usually reviewed by some advisory board within the state, and then the school receives an actual award designation that is usually displayed in the school. So the moment the families walk through the doors, or even if they're researching the school and looking on their webpage, they know that this school is prepared to support their students. So from a national study done by the Center for Public Research and Leadership in the Military Child Education Coalition, we can see that this program reports positive impacts from parents and staff at the school on those military connected students' social and emotional learning. And you can just see the benefits on both sides on how helpful and very helpful that this program is to their students and their young person's learning and support. And so this is definitely, this study was done first in 2021 with 7 states and again in 2022. And it's just overall great for the students, great for the families, great for the schools to be given an honor and a recognition that they support the military connected students. So in Kentucky, our Purple Star program is not housed in the Department of Education. It's actually housed in our Department of Substance Use Prevention. And so we created a biannual survey for our liaisons so that we can collect data on how the program is going, what kind of supports the liaison needs to be able to address the concerns of their military connected students. And we're also asking them questions about how many families they've assisted with a substance misuse or mental health concerns. What kind of other resources and things do we need to provide to them? And these are some of the quotes that we receive from our liaisons. And, you see here, letting the students share their experiences can help them be better understood by their peers. And they were blown away by the resiliency of these military connected students. And our first two schools that were awarded in 2021, they weren't near the military installation. They had a National Guard population, but they weren't those schools that were right outside Fort Knox and Fort Campbell. We have two Army installations in Kentucky. And so it has been very interesting to see that those rural counties are really interested in supporting the military connected students. And oftentimes our liaisons are military connected. And once we share with them that we have this program, they are immediately on board. It's usually it's a volunteer position, but because of their passion and their military connection, they're excited to be able to do these things that support our military connected youth. We also offer other prevention resources to our Purple Star liaisons, such as medication lockboxes, gun locks, and gun safety and firearm safety. And so now that we've built this relationship with the school, we're now able to offer them other evidence-based practices for reducing that substance use and offering classes and programs that help build that resiliency within those military connected youth and coping skills and refusal skills. So now that we've looked at all of those ways that we can impact our military connected youth, what are some ideas that you might try? Whether you're working with a local coalition or whether you are at the state level, what are some things that you might try? And if you write that in the chat box for me. And definitely check out Ohio's new Purple Star schools for the class of 2024. Ohio has really done some amazing things. They even launched, I think last year, their university program. Oh, I love it. Adding question to youth surveys, educating schools, starting the conversation. Yes. What
Sarah,
other
we do have a question in the Q&A. It says, why is the Kentucky Purple Star Award program not within the Kentucky Department of Education? Is the program getting a wide reach within SUD, I'm assuming substance use disorders? I'm not sure, or SUD in this context.
So we actually launched the Purple Star Award program from a grant that we received that addressed suicide and opioid use within military connected youth. And we did a needs assessment, and we saw the data, and I met with the Kentucky National Guard Teen Council, who explained to me, they gave me their firsthand experience about not having those connections and not having that understanding from their schools and their communities and peers. And so this was back in 2019. And, we went searching for evidence-based programs to address those things that the youth were talking about. And there was nothing really out there except the Purple Star Award program. And so we started our program as a grassroots program within Kentucky. Our advisory board was made up of representatives from the Executive Office of Military Affairs. We had liaisons from Fort Knox, Fort Campbell. We have our Kentucky Department of Education on there, but we were really looking at it through a substance use prevention lens. And we created our logic model, and we identified, you know, those consequences and those factors that we really wanted to address. And so we chose to launch it through our Department of Substance Use Prevention so that we could get that evaluation and get that data and really make sure that we were using our SPIF, our strategic prevention framework, and making sure that we were really impacting that local community. And we chose to do it that way instead of doing it through the Department of Education. They are a partner of ours. And we use our prevention workforce at the local level to market it to schools. They market it to their local coalitions. We still get support from the Department of Education. They send it out in newsletters. We have our Center for School Safety that provides information and things. But because we have those boots on the ground prevention staff that are working in the local schools already and working with those local coalitions, we find that, you know, those face-to-face connections and relationships really helped grow our program. And now, after launching 2 years later, we have 92 schools in Kentucky that have been awarded the Purple Star Award program. And so we are just continuously evolving and looking at ways that we can really integrate the Purple Star Award program into our prevention work. And I hope that answers your question. We just did it a little differently than other states. So our marching orders are to increase that readiness and capacity. Where do we go from here? So now you have that information. You know what the best practices are. Where do you start? I love that you all are already talking about adding the question to surveys and starting conversations, and you know, whether that's starting with a readiness survey of local coalitions or other surveys, community surveys that you already be using. You could easily add simple questions on there, find out what those coalitions and local organizations are implementing. And so that's where we can really start, is to assess our communities, see where they're at, and then start addressing, you know, who's missing from the table and connecting with these partners. You know, it was not too long ago that the federal government worked in a huge silo and didn't feel that they needed help from the local community. But I am really excited to say that that is no longer the case. You've got your Veterans Affairs Hospital that now has a community engagement and partnerships coordinator. Our coordinator at the local VA attends all of our all of our substance use prevention coalition meetings, and they are doing the same work that we're doing, just at a different level. The National Guard and Department of Defense, so the Department of Navy, Department of Army, they now have brand new integrated primary prevention officers. This is a brand new initiative that is being pushed out from the Department of Defense, and they have prevention specialists in the National Guard and in the military installations. You've got National Guard teen councils. All these states have National Guard teen councils that can provide resources and support and partner with them to do all kinds of things, conferences, trainings. They hold quarterly trainings, and you can do some Too Good for Drugs or other resiliency evidence-based prevention programs with those groups of youth. You've got your State Department of Veteran Affairs. You've got your local veteran service organizations, such as your VFWs or your American Legions, that you can invite to be a part of your coalitions. You've got find out who your local Purple Star schools are. You know, Ohio just announced new schools. If you just type Purple Star schools and your state, you might see some news feed on some new schools that have been recently awarded. You've got veteran resource groups at your local businesses. You've got school liaison officers. And so in order for us to do our jobs well, we need to collaborate with the people who have the right skill set and the right knowledge to solve these problems. I will say, if working with the active duty component of the military, we have to be patient. We have to build trust. We have to understand that they may move around. You know, it's very similar when working with legislation and those local policy makers. You know, you build a relationship, and in 2 years, they may not be there, or they might be deployed or switched to a different location. And so we have to understand that we have to be patient, and we have to really build that trust with those partnerships. Another great partner that is not listed on here is the Governor's Challenge Team, which is a SAMHSA initiative to suicide within military connected adults and youth. And so every single one of your states has a Governor's Challenge Team. And so you can partner with them as well. You guys have already hit on the nose, collecting data and finding data gaps. I saw Ohio put where you can find reports for Ohio military connected youth under enrollment data, but measuring communities is the website that I use to find the data that I showed you on an earlier slide. It'll tell you all of your military connected youth and adults. You'll also find some adult data as well on there. We recently added a military identifying question to our YRBS survey. And so in order for us to be able to evaluate our prevention programming against the national level, we need to have that national data. And I encourage you to work with your states and get those questions added. Look at your Department of Education school report cards. You've got Center for School Safety report cards, and look and ask for that desegregated data that's looking at the differences between those military connected youth and non-military connected youth. Look and ask for the Department of Public Health data. And you can ask for data from your Purple Star schools, creating those coalition surveys. And so finding out what data is out there and what data that you may be missing. So looking for those data gaps and advocating for military identifying questions to be added. And I do just, want to say, even within your coalition sign-in sheets, start asking that as a demographic. When we document all of our work in our statewide system, we check how many individuals from the meeting were military connected. And so all of this data, those individuals may already be sitting on your coalition meetings, but just not mentioning that they're a veteran or the spouse of a veteran. And so by starting and adding just a simple question and being able to identify, we can really start to that needs assessment done and really start to start implementing these practices to support our military connected youth. If you find out that your coalitions need more information and more training, this just shows a bunch of different resources from the different states on where you can find military student resources on their Department of Educations. We talked a few times about your MIC3, the Military Interstate Children's Compact Commission. If you go to that website and find your state, it will tell you who is the person, the executive director. You'll have the executive director, and you'll also have the Department of Education contact on there. And you can reach out to them and find out how you can start supporting those initiatives that are already being implemented in your states. And then looking at some national resources, you've got the militarychild.org, which is the Military Child Education Coalition. They're the national advocates for military connected youth. You've got Blue Star Families. Military One Source has a great resources for families and providers. Psych Armor is one of the few places that offers trainings on military connected youth. They've also got trainings for employers, for healthcare workers, mental health care workers. They've got tons of information, and it's all free. And as I mentioned, we have this national initiative, Purple Star USA. Save your date. October 24th will be our 3rd annual national convening of Purple Star schools and communities. You can visit that Google site to see what the last 2 conferences have shown and all the presentations on there. You will see, again, huge shout out. Ohio has been an amazing partner and friend with this initiative. And you might see some of your local folks presenting on that conference. And there's downloadable PowerPoints that you can share, as well as access all of the recordings. So it's a great resource for you all. And with that being said, I really, really thank you all for joining with me today and celebrating our military connected youth in this month of the military child. Myself wearing purple for purple of the military child color, because it is a combination of all of the different branches of the military. And so next week, April 15th, is National Purple Up Day. Wear your purple proudly, post pictures. You can use hashtag purple up and really help increase that presence for those military connected youth and families that are in your communities. And thank you all for the amazing work that you're doing and the time that you took to spend with me today. I truly appreciate all of you.
All right. Thank you so much, Sarah, for the wonderful information. So important to hear. And I just really appreciate your sharing both your personal experiences as well as your professional experiences working in this area. So thank you so much. Before we log off for today, I wanted to make sure everybody knows about some upcoming events that we have for you all. First, we have next week, harnessing AI in your substance misuse prevention work. We have Brian Klaas from Johns Hopkins is going to present that, and it's going to be fascinating. So be sure to join us. On April 25th, we have strategies for preventing substance misuse in older adults. So if you're interested in learning more about that topic, be sure to join us. On the first Thursday in May and June are the last 2 sessions of our deep dive into prevention ethics. So if you're wanting to dive into some more details and application of our ethical principles, I encourage you to sign up for those. Working within rural communities. If you are a substance misuse prevention professional that serves rural communities, be sure to join us on May 16th. We have a panel of folks who are going to talk with us about working within rural communities. On May 30th, we have a 3-hour training. So this is an interactive training that's going to happen on project management skills for substance misuse prevention practitioners. Preventing youth cannabis use. This is Jason Kilmer is going to present on June 4th. If you've seen Jason before, you'll know he is a dynamic speaker, really fun, but very interesting as well. Lots of great information about cannabis use. June 20th, Media Literacy 101 for substance misuse prevention practitioners. So if you're wanting to learn more about media literacy and how to use it within your substance misuse prevention effort, please join us for that. And then one other I wanted to highlight is using storytelling techniques to create highly engaging and impactful presentations. This is also Brian Klaas from Johns Hopkins is going to present this. I saw a previous training that he did on this and it changed the way I do presentations. So I highly recommend that if you do any presentations within your community, if you do trainings, anything, be sure to join us for that. Wanted to let you know also about a free resource that you can download from our website on that we decided to take the healthy knowledge courses that are available and categorize them for you so you can find what you're looking for much more easily. So if you use the healthy knowledge site to access free online courses, be sure to download that for some easier way to access them. If you haven't already, I highly encourage you to like and or follow us on LinkedIn and Facebook. This is where we can share the most up-to-date information on a daily basis to you. I did go ahead and post some links for this webinar as Sarah was talking today, so go check out those posts if you want some more follow-up information on today's session. And last but not least, as Jen mentioned at the beginning of the session, please take time to fill out the evaluation form, which you will be redirected to after the close of the webinar. This is how we can continue to improve upon what we're offering to you all. Every comment that you write in there, I read, so please know it doesn't go into a black hole. It is read, and we take action on that information that's provided. With that, one last thank you to Sarah. So appreciate you and all that you're doing. And a huge thank you to all of you who joined us today. And one last thank you to Jen, who is on our production team, who has been working behind the scenes on this webinar. So thank you, Jen, as well. Everybody have a fantastic rest of your day. Take care.